Good morning, everyone. It's Nurse Leo here, and I want to talk to you about pediatric asthma.
What's that?
What's that, you ask? Oh, buddy, it's a little diagnosis your doctor just gave you. So, this is when your bronchial airways decide they want to inflame and constrict, usually due to triggers such as exercise, allergens, pollen, dust, you name it. A few scary symptoms such as shortness of breath, wheezing, chest pain, and nasal flaring and coughing attacks can occur. Now, any questions?
Is that why I'm having such a hard time breathing sometimes?
Why, of course it is. But worry not, my child. Today I will be helping you learn how to manage this condition.
Really? Please tell me how to control this problem, Mr. Rivera.
Well, first, let's look at our primary focus. So, first and foremost, we want to focus on the triggers of your asthma. Now, these triggers in asthma can exacerbate an attack. So, our main concern is always to avoid these triggers. These triggers can vary from person to person, and some of the most common ones include exercise, dust, cigarette smoke, pollen, chemical irritants, and even dandruff from pets can trigger some of these attacks.
What even are pets? But what if I can't simply stop cuddling with Oreo or coffee?
Well, worry not, because as we have been able to deduce, your asthma is caused by dust. So, what do you think you're gonna do now?
Oh man, but I hate cleaning.
Well, buddy, I hate to break it to you, but it's the best thing we can do to help your asthma. However, the last thing I want is for you to be the cleaner. Alright? I want your parents to clean because I want you to try to avoid your room as much as you can. Any, contact with that dust can just make your symptoms worse, and that's not what I want. So, have somebody else clean your room for you. Once your room is clean, make sure to keep it clean anytime you go in there. Alright? Okay.
So is that it? Just clean my room?
Well, it's not as easy as that, which leads us to our next segment. Long-term treatment of asthma.
And how does that work?
Well, let's just say there's quite a few things we can give you to treat your asthma in the long term, as such of these things are medicines such as corticosteroids that are inhaled. I just realized, can you see me in the video?
No.
Oh, bruh. Okay. Let's go ahead and
We're restarting?
No, let's just zoom out. See? Like that. Alright. So, some of these medicines that we can give you, stand up please, are inhaled corticosteroids, leukotriene modifiers, nebulizer treatments, and combination inhalers. But these are only medicines to decrease the inflammation in your lungs and meant not as a rescue method, but more so for long-term treatment. Stuff that you take on a daily basis so that your lungs, so that we can prevent any asthma attacks from happening. Alright?
Mm-hmm.
Okay.
But what if I still get an asthma attack even with these treatments?
Oh, what a brilliant question, kiddo. So, this is where rescue medicines come into place.
That sounds scary.
It can be, but that's why we like to stay prepared and make sure you know what to do in this occasion. So, see, there's this cool medicine that we have come up with called albuterol. So, the cool thing about it is that it comes in a quick relief inhaler. So, it can quickly relieve an asthma attack, but do not be fooled, because as soon as you are able to treat your asthma and get it under control, I want you to also use your long-acting corticosteroid inhaler, because that way we can keep your asthma attack controlled, because the last thing we want is for you to be fighting off another attack in 4 hours when this wears off. So, keep in mind, only do 2 puffs every 4 hours, okay? If you are experiencing an attack, 2 puffs. But you want to do 1 puff, and then wait a minute, another puff, okay? And then if your symptoms do not get any better or even get worse within an hour, I want you to use it again. So do 1 puff, wait a minute, and then do another, and then call your doctor, or have your mom call the doctor, or the school call the doctor, so that way we can figure out what to do next. Okay?
Wow, this really seems serious. I must try my best to not get to that point.
Yes, you are very correct. However, I still want you to practice using the inhaler in case it does get to that point. Alright? So, what I just showed you, I want you to go ahead and show it to me. Okay? So, you're having an asthma attack. Okay, now what? No. What are you going to do first?
I don't know.
So, you inhale 1 puff, and then what do you do?
Wait a minute.
Mm-hmm. Wait one.
That's what I was doing.
Yes, wait 1 minute. 60 seconds. And then do it again. Alright? And now, after this, go ahead and sit down. Take a seat. No, not another one, okay? So now you take a seat. Try to cool off a little bit. Try to get control of your breathing. Alright? And then once your breathing is controlled, I want you to get your long-term, your long-acting corticosteroid inhaler, and take the dosage for that. Okay? So in this case, if you were at the school, what I want you to do is go to the nurse's office. Okay? And he went to the nurse's office. All right.
Hi, nurse. Thank you.
See, he's doing it. He's doing it. Oh my goodness. All right, Tony, come on back.
Thank you, nurse.
How do you feel now? How do you feel now? Much better? Awesome.
Huh? Okay, so that wasn't so hard.
See? And now you are prepared for the worst. Remember to be on top of your asthma, okay, buddy?
Will do, Mr. Rivera.
Now, the last big thing I want you to keep in mind is stick to your asthma plan. Alright? I want you to keep track of anything that makes your symptoms worse. So, say you're doing the pacer test at school, and then you start overexerting yourself and your asthma starts acting up. So, in that case, I want you to write down in a notebook or somewhere after you control your asthma that exercise is making your asthma worse. So that way when you go to the doctor's office next, or when you go home and tell your mom, that your mom can tell the doctor that exercise is making your asthma worse. So that way we can work on your plan to either increase any medication doses that we need, or implement something else into your plan. Okay? So, I want you to keep track of how often you have problems. That way you can make sure you let the doctor know if your medicine is not helping control your symptoms, to see if he can maybe change your dosage. Alright? Sticking to your plan is going to allow you to catch any issues right away And that way your doctor can help you take action quickly to help accommodate. Because let's say you're not having many problems anymore, so what your doctor's going to do is he's going to decrease your medication dosage. So that way your lungs can start adapting to helping themselves. And then maybe you don't even have asthma anymore. It is a possibility. But in order to do this, you must keep track of your plan. Alright?
Thank you so much, Leo. I'm gonna kick this asthma in the butt.
That's right, buddy. Heck yeah.